Thank you and welcome to the show this morning. The topic this morning is persons with AIDS. And we're fortunate to have with us two persons to talk about persons with AIDS this morning. Ms. Sherry Wood. Ms. Wood is the Executive Director for NASHVILLECARES. And with Ms. Sherry Wood is Mr. Don Dobbins. Mr. Dobbins is a person with AIDS, and Mr. Dobbins is also with NASHVILLECARES. And let me welcome you, Ms. Woods and Mr. Dobbins, to the show this morning to talk about this very, very important topic. Ms. Wood, we've had an opportunity to talk with you on a number of occasions in reference to AIDS and NASHVILLECARES. And let's have you to sort of give our audience a summary of some of the activities that NASHVILLECARES is involved in, as well as some of the things dealing with AIDS, AIDS as a disease. And of course, after that, we'll have Mr. Dobbins to talk about his illness. Let's start with you.
Thank you, Dr. Haney. It's good to be back with you today. NASHVILLECARES is a community-based organization that deals only with people with HIV or full-blown AIDS. And one of the important things that we do there is our client services department that deals with people that are HIV positive from the time they're diagnosed on into the end, which is a nice thing now. It can be 5–10 years. People now have a chronic disease. And our department provides individual counseling at diagnosis or throughout the illness. We provide support groups for all different types of people and people with all different needs to help them meet other people struggling with the same problems. We also provide assistance with housing and transportation and with medicine and with food. We just received a grant from the Department of Housing and Urban Development in Washington. It's called HOPWA, which will enable us to provide a great deal more assistance with rent and with mortgage payments in order to keep people in their homes. So we're really excited about that. It also will give us a greater presence throughout Middle Tennessee. Other things we do there at NASHVILLECARES is a prevention education department that gets the word out to people so that they can learn how they can prevent the spread of this disease, how they can protect themselves, and so that they're no longer afraid of the disease and afraid to touch and love someone that has the disease. We also run a volunteer department that's extremely critical to everything we do, and people, if they wish to work with HIV and people that are in need, can call us, go through a volunteer training, and become buddies or members of care teams. They can help us with many of our fundraising efforts. They can help us and assist us with answering our telephone or being part of our hotline program, where we provide a hotline from about 8 in the morning till hopefully most times 9 in the evening. So that there are many things someone can do that wants to get involved with this crisis and help us make sure that those in Middle Tennessee and throughout the state receive the kind of care they need.
Very good. Thank you very much. Mr. Dobbins, let me first of all thank you for being willing to come on and talk about AIDS as a disease that has had a tremendous impact upon your own life. Let's sort of put a face to the numbers that we've seen quite recently in reference to the number of persons who have this disease and the impact that it's having. Let's have you to give us what you consider to be an overview of your illness, how you contract the disease, and some of the things that you feel that our audience might be willing to listen to this morning.
Okay, I'd be glad to do that. Hopefully your audience, as they watch this show, will probably, as most audiences that I've spoken to over the last couple of years, will look at me and say, he doesn't look sick. And yet he's sitting there telling us that he has AIDS. And that's a real common reaction. I'll give you a brief overview of what happened in my particular case. Many of us have those periods in our lives. Sometimes they last a day, sometimes a week, maybe a month for some folks, where we don't feel good about ourselves for whatever reason, low self-esteem, something going on in our lives that clouds our judgment for a while. And I went through a very difficult period in my life that lasted several months and eventually turned into a year or so. And it was during that time in my life, after a failed marriage and after a failed ministry, things that meant quite a lot to me in terms of what I was trying to accomplish in my life. I entered into a period of depression, And that's when I began to put myself at risk. I contracted the illness in February of 1990. I tested positive in April of 90. I'm pretty confident as to when I contracted the virus. As Ms. Woods mentioned earlier, it could take 10 to 15 years before most people show any outward symptoms, although inside their body the immune system is collapsing. In my case, because I was in such a state of depression prior to contracting the virus, it took only about 8 months before I started showing some signs. I developed a very severe throat infection, and in about 3 months' time, I lost over 40 pounds. A lot of the problem that I was having in dealing and coping with my illness is that I was keeping it quiet. I was keeping silent about it. I was ashamed. I didn't know how to answer people's questions because it's human nature to say, "How did you get it?" And so for a year, I didn't tell a soul. And just after a year of living with the illness, I was at the point of death. It was at that point that my mother, I had moved back home, my mother confronted me, and she wanted to know the exact nature of my illness.
And it had almost been a year, and you had been sick in your own home, but you had not said anything about this.
No, not to my family. I was afraid that they wouldn't know how to accept it. My mother figured it out, though. You know, never underestimate the wisdom of your mother. And she confronted me and asked me if I had HIV. And I was faced with a decision at that point. I knew that the silence was killing me, so that was an option because many days I didn't really want to live. The other option was to take a chance and see what happened, and I took that chance. That was almost a little over 2 years ago. And from that point on, when my mother accepted it, the rest of my family accepted it, and I made the decision at that point that I was not going to live in a cave, that I was going to be very open and public about my illness. And it's been through primarily Nashville Cares that I've had the opportunity to speak to thousands of people in the Middle Tennessee area. And it has, I had been on disability for 2 years as a result of my illness. But by speaking out and sharing with other people, I've been able to regain enough of my health back that a position